Maybe the forecast put your heart aflutter.
I know.
What?
I know, that could bring your blood pressure
That
up
could
too.
raise your blood
Absolutely.
pressure. So the American Heart Association says preventing high blood pressure needs to start early, because if it's not treated, it could lead to risks of serious health problems. So Dr. Art Mollen is here telling us about the warning signs, what to look for. And you know what? The first question would be, what do those numbers even mean, Dr. Art?
Right. Well, first of all, high blood pressure is a silent disease. So a lot of times people have high blood pressure, they don't even know it. And that can be a serious thing because it causes heart attacks, it causes strokes, it can cause kidney failure. So those are some of the things that we're concerned about. Now, there are two numbers. There's the first number, which is your systolic blood pressure, and the second number, which is your diastolic blood pressure.
Okay.
So a lot of people have these home blood pressure cuffs, and they can measure that for them. So some of the symptoms could include a headache, it could include nosebleeds, anxiety, chest pain, shortness of breath. These are some of the most common symptoms that may indicate that you do have hypertension. So be on the lookout for that. So the top number, the systolic number, again, and we're taking your blood pressure right now, so we'll see where it's at. You said you usually have a pretty good blood pressure. The normal blood pressure for people is usually about 110 over 70 or 120 over 80. They're all normal, but if it gets to 140 over 90, then that's considered to be high blood pressure, and that's something that we are really concerned about, that you have to be on the lookout for.
It got higher while I was sitting here.
Right, and yet we used to, and yours is coming out 116 over 82, so that's perfectly normal, and there's nothing to worry about. So a lot of times people say, well, what causes high blood pressure? Well, it's a high sodium diet. If you're eating too much salt, if you're overweight, a lack of exercise, stress can cause it. And then there's white coat syndrome. So when you walk into your doctor's office and you see that white coat, suddenly your blood pressure goes up. So that's why it's important to actually have your own blood pressure cuff at home and be checking it, because a lot of times your blood pressure at home may be perfectly normal, but on the other side of the coin, you go in the doctor's office and it winds up being 160 over 100 or something like that. So when should you take your blood pressure at home? You should take it in the morning, or you can take it at night. The other thing is how to actually, take the blood pressure. You should be sitting down. Your feet should be flat on the ground so that you're, not standing up and taking the blood pressure. All of those things can affect it. And basically, what type of cuff should you use? I like an arm cuff as opposed to the wrist cuffs. A lot of times people, and they'll come to my office, it's like, well, my blood pressure is a little bit different at home, so they'll have a cuff on the wrist, and that is not as accurate as these cuffs which are on the arm. They're going to show a much more accurate blood pressure. So I think for people at home, if you have a wrist cuff, go out and buy one for your arm. That's going to be a lot better. And check your blood pressure. Take your cuff into your doctor's office. Let them check it with you so that you can get an idea if your home cuff is actually working well or not. So blood pressure, again, it's a silent disease. You should check your blood pressure. If you haven't had your blood pressure checked in a year, go to the drugstore and get it checked. You don't even have to buy a cuff, they'll check it for you, but don't allow this to replace visits to your doctor's office. You still need to go to your doctor's office and have him check your blood pressure.
And it's easy and it's painless.
Exactly.
So you get a lot of information for not really doing too much.
And exercise is the best way to lower your blood pressure and decrease the amount of sodium you're taking in. 1,500 milligrams should be the maximum amount of sodium that you're eating.
All right.
Okay.
You got it. Thanks for keeping us healthy. And if you have health questions for Dr. Art, we'll send them our way. You can email him at askdrartmollen@gmail.com, and he'll answer some of your questions right here on Good Morning Arizona. Thanks, Doctor.